Good morning and welcome to the Ministry of Health and Wellness press conference to launch the findings of the 2023 National Drug Prevalence Survey and launch the activities for Drug Awareness Month. At this time, I invite you to stand for the national anthem. You may take your seats. Dr. the Honorable Christopher Tufton, Minister of Health and Wellness. Mrs. Paulette Spencer-Smith, Executive Director of the National Council on Drug Abuse Department. Mrs. Uki Atkinson, Senior Director, Research, Program Development, Monitoring and Evaluation, National Council on Drug Abuse Department. Other members of the health team represented here today, Chief Technical Directors, Directors, Managers, team members, all, stakeholders, members of the media, ladies and gentlemen, good morning. It's a significant occasion for the National Council on Drug Abuse, a department of the Ministry of Health and Wellness. And the NCDA department offers evidence-based prevention services surrounding substance misuse prevention, education and treatment, wellness support, and case management for recovery. We're going to open also with prayer at this time. I'm going to invite Mrs. Colette Curlew, Principal Director for the Prevention, Public Education and Awareness and the Treatment Branch of the NCDA, to come at this time.
Thank you. Good morning, everyone. The Lord is good, eh? And we give him thanks. So let us just invite his presence. Heavenly Father, we give you thanks for this beautiful day that you have made, Lord, and we will choose to rejoice and be glad in it. We invite your Holy Spirit now in this place to direct us, give us discernment, give us wisdom. We're going to hear some facts. I pray that by your leading, we will have guided and evidence-based interventions, Lord, that will impact our nation and make it a place of choice to live, work, do business, and raise families. So take control of this session now, Lord, and be glorified in it. We give you all praise and glory. In Jesus' precious name we pray with thanksgiving. Amen.
Thank you, Ms. Curlew. So we're getting into the program, and I am Kadisha Watkins, Senior Public Relations Officer in the Ministry of Health and Wellness. Happy to be guiding you with the proceedings. So at this time, I will make welcome Mrs. Paulette Spencer-Smith, Executive Director of the NCDA, with welcome at this time.
Thank you, Ms. Watkins. Good morning, everyone. So we want to be able to say special welcome, of course, to the Dr. Honorable Christopher Tufton, MP, Minister of Health and Wellness, Ms. Colette Curlew, Principal Director of Prevention, Public Awareness, Education and Treatment from NCDA, Mrs. Utki Atkinson, Senior Director, Research Program Development, Monitoring and Evaluation, and other members of the NCDA and health team, members of the media. Ladies and gentlemen, good morning. It is my pleasure to officially welcome you to this press launch as the Ministry of Health and Wellness, through its department, the National Council on Drug Abuse, we will disseminate the findings from our 2023 National Drug Prevalence Survey. It's also the occasion of the country's recognition of Drug Awareness Month, which is emphasized annually during the month of November. The work of the NCDA is guided by our mission, and that is to prevent substance misuse and promote psychological well-being through evidence-based services, fostering resilience and recovery. And this study represents a strong step towards achieving that mission. We must take the time to be able to thank and recognize our collaborators in this national household study, UE, MONA's Center for Leadership and Governance, the Inter-American Drug Control Commission, CCAD, of the Organization of American States, and the National Health Fund, an agency of the Ministry of Health and Wellness. Last year, the NCDA celebrated 40 years as a government agency, and this year we begin our new mandate as a department of the Ministry of Health and Wellness. We have an expanded mission with greater human resources and greater specialization, but we still continue to strive to make a greater impact in our nation's health, wellness, safety, and productivity. Our aim is to bolster our efforts all around. We are in public education, prevention programs, drug testing, drug counseling, research, publications, drug treatment court, and specialized drug training. And we do all of this to embrace our vision of having a happy, healthy, drug-free Jamaica. Ladies and gentlemen, welcome again, and we look forward to your continued support and collaboration. Thank you.
Thank you, Mrs. Spencer Smith, and congratulations to the entire NCDA team for the work that you have been doing, the expansion of your team, and we look forward to the greater efforts that you will contribute to our nation at this time. And so we move right along. As mentioned by the Executive Director, the National Council on Drug Abuse, a department of the Ministry of Health and Wellness, partnered with the UWI-MONA's Center for Leadership and Governance and the Inter-American Drug Abuse Control Commission, CCAD, of the Organization of American States, OAS, with support from the National Fund to conduct a national household survey. Here to present an overview of the study is Mrs. Utki Atkinson. She's the Senior Director of the Research, Program Development, Monitoring and Evaluation Branch of the NCDA. Please welcome Mrs. Atkinson.
Good morning, everyone. It is indeed a pleasure to see all of you here, and we thank you for coming and thank you for your patience. So, as was outlined, this study was conducted in collaboration with our colleagues from academia, from the Center for Leadership and Governance, Professor Waller and Dr. Stephen Johnson and his team, and we are very grateful to them for the hard work that they did to implement this study over approximately 8 months last year. As was said as well, the Inter-American Drug Abuse Control Commission is the main partner in terms of the protocol for the study that we used. Now, this protocol has been implemented in approximately 33 countries across the Americas. So it's very valuable to us because we are able not only to monitor what's going on locally, but also to be able to compare with countries across the region. So CCAD, we thank the Inter-American Drug Abuse Control Commission as well. And another thing I should mention is that it allows us to compare the results between 2023 and 7 years earlier, 2016, when we did the last National Drug Prevalence Survey. You should be seeing my slides. Let's just wait a second to catch up. I believe I'm at slide number 2, background about the survey. All right. Catching up? All right, so we're at the third point. Please populate. Oh, I can populate. My bad. All right, so here we go. So this was a cross-sectional survey using stratified multi-stage cluster sampling, where we had, the selection of parishes, the selection of EDs and households, and random selection of members of the household. We also, all right, sought to determine what is the prevalence of substance use in our population at the age band 12 to 65 years. So we wanted to look at various components of drug use, which include socio-demographic profile of the sample, substance use, the risk perception, and risk perception is really about how harmful do I think it is to take a particular substance. If I take it sometimes, if I take it often. Risk perception is important to measure because it is one of those factors that influence the likelihood of use or not. Access is another thing that we measured, driving under the influence, attitudes towards various policies, which you're going to see. Now, one of the good things about this survey is the fact that it is representative not only at the national level, so we have the national picture as to what's going on broadly among 12 to 65-year-olds, but it is also representative at the parish level. So we have a good idea of the lay of the land in terms of drug use. We had a total of 4,991 respondents in this survey, which is kind of like the gold standard for representativeness for national survey. More than the gold standard. The silver, no, what it would be? Diamond standard. All right, so it was really a good reflection of representativeness. The survey was interviewer administered, and as I just outlined a while ago, these are the things that we have measured in this survey. Now, just a point of note, that when we talk about lifetime prevalence is whether you have ever used this substance at all in your life. Sometimes people hear it and they think, oh, it means you're using it throughout your life. But no, it's have you ever used. So we measured lifetime, past year, and current use. As was said before, we're comparing between 2016 and now. We have important gender comparisons, parish level comparisons to look at where the pockets of high risk or harmful use is. And then we're also looking at driving under the influence, risk perception, treatment, and Minister will outline some next steps that are important for us to take. And with this, I thank you for your attention.
Thank you for that. Okay. And so we are moving to the main presentation, and I'm going to invite at this time Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, to present the findings of the 2023 Drug Prevalence Survey.
Thank you very much, Madam Moderator. So unlike in my routine speeches, I'm not going to ramble on without a script because the script is long. So I'm going to follow the script, and I'm going to ask you not to follow me by looking at me, but follow the screen where the presentation will be. I've been given specific instructions to stick to the script. How is that? So we can get out of here and you can get the meat of the matter. Who is controlling that? I'd prefer somebody else control it, right? Because I can't even see it from here very well. So I hope you have a copy of the speech so you know when I go to... Well, I'll say slide 1, slide 2. I don't have to. I'll say it anyway. How is that? All right, so let me just, first of all, just recognize all who are here. Your moderator, Ms. Watkins. I don't see the PSR or CMO, but Ms. Paulette Spencer-Smith, Executive Director of the National Council on Drug Abuse, who was recently appointed or elevated to this role, both appointed and elevated. And we wish her all the very best. And this is a good way to start. So there's a lot of data here that is important. Ms. Atkinson, Senior Director, Research Program Development, Monitoring and Evaluation, National Drug Abuse, National Council on Drug Abuse. There are other directors here, too many to mention in the ministry, other critical stakeholders, including the media, but also from other organizations. I see the Heart Foundation of Jamaica. How are you, Ms. Debbie, and your team? I'm sure probably the Cancer Society is here and others. I just want to welcome you. Full house. Didn't expect so many, but happy to have you all. So this study, I would like, even though we did one in 2016, I believe, we're now in 2024, so that's what, 8 years approximately, is intended to establish a baseline of information around substance abuse. And hopefully from the data that we gather, that information will then be utilized in a series of activities to guide public health, to guide policy, to guide specific programs and initiatives. And we saw this as very important to do. As you know, we are moving ahead with tobacco legislation with hopefully the final committee of the parliamentary group on Thursday last, I believe. There's still a little work to be done, but we're hoping to complete that and then to table and debate for comprehensive tobacco overhaul. There is a draft alcohol policy, which is in draft form, and we decided that this study would help that process. And then there are many other conversations taking place around alternative drugs, cannabis in light of the recent liberalization of approach to that substance. And it was very timely and relevant now to try and come out with a study. I want to thank the team that did this study in collaboration with the council. What's the name of the company again? They're based at UA, huh? Center for Leadership and Governance. Dr. Wall and Dr. Johnson are here. And I think they have done a good job based on the peer review of the work done. And the number of persons that have been interviewed, as said earlier, is quite a large enough population to draw some very important conclusions. So we are confident in the science behind the work, and the results, therefore, are good guides to what hopefully will become a program of work in time. So November is National Drug Awareness Month, and we're celebrating under the theme, or should I say recognizing under the theme, Know the Facts. Now let's act. And today we're presenting the facts and encouraging all of us to act. The theme is as timely as it is important as we focus attention on harmful alcohol use, tobacco smoking, and the use of illicit substances that compromise the physical, social, and economic well-being of Jamaicans. Unfortunately, despite the proven dangers, drug use persists and in some contexts proliferates. It is critical, therefore, that we open the conversation, providing Jamaicans with the facts about drug use, and in so doing help to create the necessary enabling environment for sound decision making. The data that is to be shared here today makes this imperative. So in terms of global data, 275 million people used drugs in 2020, up by 22% from 2010. By 2030, demographic factors project the number of people using drugs to rise by 11% around the world, according to the World Drug Report 2021. Alcohol consumption globally contributes to a reported 3 million deaths annually and to disabilities and poor health of millions of persons. The harmful use of alcohol is the 7th most important risk factor for mortality worldwide and is responsible for 1.5% of global burden of disease. This is a harmful use of alcohol. New psychoactive substances, NPS for short, present unique challenges as markets witness the introduction of new drugs that are unpredictable, poorly understood, and which present distinctive requirements, not only for drug treatment, but also for public health and drug policies overall. Given these realities, Jamaica's latest general population survey, with its sample size of close to 5,000, as said earlier, respondents, provides timely and needed insight to support policy development and targeted intervention. And I'm now at slide 4, according to my script. Prevalence, alcohol, cannabis, and tobacco. As mentioned, epidemiological measures of substance use explore lifetime, past year, and current use. Alcohol, cannabis, and tobacco remains the drugs that are mainly used by our Jamaican population. 8 in 10 Jamaicans, or 77%, have consumed alcohol at some point in their lifetime. 6 in 10, or 60%, used in the past year, and 5 in 10, or 46%, in the past month. 3 in 10, or 30%, have smoked cannabis, of course, ganja, and the same for smoking cigarettes. 3 in 10, just over 30%, 31.5% in their lifetime. In relation to past year use, 2 in 10, or 19%, smoked cannabis, and 2 in 10 smoked cigarettes. Current prevalence of cannabis use is similar to the past year, with 17% of the population reporting this level of consumption, while 1 in 10 reporting smoking cigarettes. That's 11.8%. In terms of slide 5, gender comparisons. The survey revealed that use among males is significantly higher than females across all measures, lifetime, past year, and current, which is consistent with previous population studies, including among secondary school students. This mirrors what is happening globally, where the use of most psychoactive substances is notably higher among males. What is being experienced in several societies is a narrowing of the gender gap, with a greater proportion, however, of women using substances than in the past years. The survey also revealed that the age of onset of use for males is approximately 2 years earlier, age 16 years, than the age of onset of use among females, which is approximately age 18 years. In terms of slides 6 and 7, lifetime prevalence of less popular substances, the survey revealed that less than 1% of the population report lifetime use that they had, in other words, that they had ever used, of cocaine. This is similar for tranquilizers, stimulants, inhalants, or depressants without a prescription. You do know that prescription drugs can be abused. And the survey is saying that less than 1% have indicated that they have used this. Successive population studies have also shown this, so this is relatively consistent according to the survey. The newer, more recent psychoactive substances are not heavily featured among the general population, and this was expected. Although we know the popularity of substances like Molly and ecstasy, we say MDMA, and we know that it is rising, particularly among youth and young adults. We did not see significant proportions reflected in the survey such as these. We have evidence that pockets of the population are using these drugs, and this evidence will be shared at a later date based on a synthetic drug rapid assessment recently concluded in 4 Caribbean countries, Jamaica, Barbados, Guyana, Trinidad, and Tobago. So more information will be provided on this as we narrow the focus a bit to some specific categories of the population. Among the general population, use of synthetic cannabis, MDMA, lean, that's the mixture between cough syrup, medicines, and sweets, and magic mushrooms accounts for approximately 1% of the, or just below 1% of the population, based on the survey. 7% of the population reported use of e-cigarettes at some point in their lifetime, while almost 20% reported that they had used grabber. And we know what grabber is, right? We're in the business to know what it is, not to use it, but to know what it is. This is likely to reflect those who mix grabber, tobacco leaf, sometimes soaked in different mixtures and chemicals to change its taste and effect. With ganja, as this is a popular practice among young men in particular. We're now looking at slide 8. Comparisons between 2016 and 2023. There are clear indications of increase in substance use among the population over the past 7 years across all measures: lifetime, past year, and current use. This is most notable in the 4% increase in the past year, that is from 56 to 60%, and current 42 to 46% alcohol use, and the same level of increase, 4% in the past year, in the use of cigarettes from 12.7% to 16.8%. It's a very important statistic because what it shows is that there is more consumption in all the different categories. And that clearly, from a public health perspective, should raise some alarm bells and require some amount of deeper analysis and understanding in terms of a response. Slide 9, Jamaica map, drug use by parish. There are important realities to note as we disaggregate the data by parish. The map shows the current prevalence of alcohol, ganja, and cigarette use across the 14 parishes. It is noteworthy that alcohol prevalence is significantly higher in Trelawney, 57.5%, St. Anne, 54%, and Kingston, 52%, than the national prevalence of current alcohol use, which is approximately 46%. For ganja, significantly higher current use is evident in Kingston, 27%, Trelawney, 23%, and Clarendon, 21.8%, compared to other parishes and a national prevalence level of 17%. So what we're seeing is our parishes that are really outstanding, or outliers, if you will, above the national average, both for alcohol as well as for marijuana use. For tobacco or cigarette smoking, St. Andrews 17.5%, Trelawney 16.1%, and St. Anne 14.5%, featured highest compared to other parishes, and the overall national prevalence, which is 11.8%. This doesn't mean we have no issues in other parishes. What it does, it provides us with a vital information to tailor relevant prevention and treatment-related strategies to fit the different contexts and the different environment. So, the truth is that even though we're talking about one country, there are subcultures that may be unique based on particular features in different parts of the country. And what we're doing is singling out on a parish by parish level some of those that stands out. It doesn't mean that we can't apply a strategy right across the board, and we will, but we may need some particular intervention in some of these environments based on the responses. The survey also explored harmful and high-risk patterns of substance abuse. Harmful alcohol use was measured using the alcohol use identification test, and this revealed harmful patterns of alcohol use among approximately 16% of the population, which is at the same level as 7 years ago. And there's a definition for harmful use, but it is kind of explicit or implicit in the term harmful use. Use to the point of putting you in harm's way, right? Harmful use is the most evident among the 25 to 35 age group, while current ganja use is most prevalent among the 18 to 25 age group. Among those who smoke cigarettes, daily use increased from 7% in 2016 to 11.6%, approximately a 5 percentage point increase. Another concerning finding is the fact that among people who smoke ganja in the past year, approximately 66% of them were deemed as high risk for dependence as measured by the cannabis abuse screening test. And this represents a 15% increase from 50% 7 years ago. This again is worth noting. We have over the last number of years essentially liberalized the approach to marijuana access and consumption, and we're seeing evidence of an uptick in consumption as a result, or use as a result of that, which clearly means greater public education and some other efforts to try to discourage. This is significant. We need to pay keen attention as it reflects that studies are showing in other countries that have changed their cannabis regulatory framework, legislation, and decriminalization. What we are seeing is that the overall prevalence has not increased significantly, but the intensity of use among those who already use it has increased. This is what other countries have also found. In relation to driving under the influence of alcohol, another area, this has increased since 2016 from 14.4% to 17.5%, according to the survey. 10% of drivers reported driving under the influence of other drugs, to include cannabis and other illegal drugs, down from 14% in 2016. The use of edibles, cannabis-infused food, has increased by 7%, from 6.6 in 2016 to 13% in 2023. This we are not surprised at by the finding, as the popularity of edibles, based on our anecdotal information, persons turning up at hospitals and so on, is evident among youth and young adults, popular in parties and stage shows, and easily accessible in a variety of places island-wide. And we're seeing evidence of that in terms of increased willingness to try and certainly to consume. 10% of adolescents 15 to 17 years reported use of edibles, and the highest level of use was reported among males in the 35 to 44 age group, and females in the 25 to 34 age group. In terms of males, 28%, in females, 13%. Slide 10, harmful alcohol use identification test. And we have, in keeping with benchmark standards, zones of intervention. Among the vulnerable aspects of the audit tool that was used in this survey is a determination of the type of intervention that is needed for the population based on their pattern of alcohol use. There are 4 zones, which include education, Zone 1, that is educating the population. Simple advice, Zone 2. Brief intervention and monitoring, Zone 3. And specialist treatment, Zone 4. The findings reveal that the majority of our population need education about alcohol. 17, almost 76% actually, need more information about abuse or harmful use. And approximately 20% or 18.3 need simple advice. The proportion that needs brief intervention and monitoring is 3%, and this is the same proportion that needs specialist treatment, 3%. And basically those who need intervention or specialist treatment would be those who are consuming at a level that is extremely harmful, maybe addiction or otherwise. But what is clear here is that general advice to the population is important. When broken down by parish, specialized treatment services are most needed in Clarendon, St. James, and the KSA, while brief interventions are most needed in Trelawney, Westmoreland, Manchester, Clarendon, and the KSA. We have to drill down a bit more on this data to determine how we tailor interventions to address the challenges, but this gives us the baseline from which we can now develop a roadmap to move the process further. Slide 11, driving under the influence of alcohol and other drugs. Approximately 18% of drivers have driven on our roads under the influence of alcohol in the past year, according to the study, with significant more males, 23.9%, than females, 5.2%, reporting this. The practice is highest reported among the 25 to 34 age group. Approximately 1 in 3 persons in this age group are accepting or admitting in the survey that they have driven under the influence. And I guess we could conclude that we see the manifestations of that, if not in whole, partly so, on some of the carnage and the unfortunate incidents on our roads. Again, this will need further drilling down and hopefully will influence the level of intervention or the type of intervention. 10% reported driving under the influence of illegal drugs, with males accounting for some 15% and females 1.3%. So again, a male-dominated space, the willingness to risk driving under the influence of illegal drugs. We are keenly aware of the risk of driving under the influence of psychoactive substances. And just to note that the United Nations had dubbed 2021-2030 the decade of action for road safety. And among the goals is to cut in half the number of road traffic injuries and fatalities related to drivers using alcohol, and/or achieve reduction in those related to other psychoactive substances. And the data is there. Approximately 1.19 million people die each year because of road traffic crashes, according to the World Health Organization. And at the same time, road traffic injuries are the leading cause of death for children and young adults aged 5 to 29 years worldwide. Driving under the influence of alcohol and any psychoactive substance or drug is known to increase the risk of a crash that results in death or serious injuries. So what this study is suggesting, the survey, is that we have some work to do in this area. And again, the manifestations of that are evident based on what we see happening on our roads. And this will also require some sort of further interrogation and collaboration with key partners, agencies of the state as well as civil society. Slide 12, risk perception by drug use. How harmful is it to use frequently? So we're looking at frequency of usage. Findings on the perception of risk of using substance on a frequent basis reveal that although Jamaicans understand the level of risk of using in this manner, knowledge alone does not change behavior. So we are accepting that public education is needed, but that is maybe a requirement, but not sufficient to change behaviors. Something to note here is that in relation to vaping, In 2016, 30% of the population did not know how harmful vaping was. This has decreased to 20% according to the survey in 2023. We're of the view that the efforts of the NCDA and partners such as PAHO, the Heart Foundation and others through World No Tobacco Day observances and other public education initiatives are likely responsible for this shift in the right direction. So there's a small win there, but nevertheless, efforts must continue according to the survey. There is, however, more that needs to be done, as said earlier, in this area, particularly among our youth who are specifically targeted and many times with fairly deceptive strategies around being attracted to these types of alternative smoking, if you want to call it, yeah, vaping. Oftentimes with not knowing what is actually the chemicals being used in these devices. A concerning finding here is when disaggregated by age group, we found risk perception to be consistently lowest among the adolescent population, that's 12 to 17 years. It reinforces the fact that we have a big task ahead in terms of the influence of social media, popular culture, pro-drug use attitudes, influencers of one form or another. And you've heard me speak about this, many others have too, around the use of vaping devices in our school system. What the survey is suggesting, it is confirming that this is a high-risk group. And so collaboration with the Ministry of Education and with other groups is very, very important. So this is a confirmation based on the survey. Slide 13, ease of access to illegal drugs. Access to illegal substances is consistent with what we know of our context. Almost 70% of the population report easy access to ganja, while use of access to other drugs like cocaine, ecstasy, molly, crack, and magic mushrooms was significantly less. But you can find it if you really search. And again, that creates a more comprehensive challenge for the authorities, for health, for others, in terms of the public education and awareness, and hopefully through that discouraging trial. Slide 14, need for drug treatment. Approximately 3% of Jamaicans, 12 to 65 years, reported feeling the need for specialized services to reduce or stop using psychoactive substances. The population here is estimated to be about 60,000 Jamaicans. So that's 60,000 Jamaicans who, based on the survey, would need special intervention based on the addiction that may have been developed through the abuse of these substances, psychoactive substances. Slide 15, reasons for not accessing drug treatment. Among the main reasons for not seeking drug treatment were lack of awareness of where to go, that's over 37%, not feeling ready to stop, 21%, and affordability, 14%. And again, those numbers will have to be looked at carefully. We're also seeing a significant gender difference, where more women noting no space in treatment programs for them, 10%, transportation issues, 12%, affordability issues, 27%, and it speaks to the need for special consideration to tailor services to maybe meet the unique requirements of our women. And again, that will require further interrogation and assessment. Slide 16. This is a conclusion, and I'll reflect that in a few slides. So this study is, for us, a significant snapshot of the current landscape of drug use among our population. We see that the burden of use is disproportionately higher among males, that we have a problem areas of harmful use which require targeted interventions, and the challenge of increased high-risk cannabis use, and the impact on the health of those who are problematically using requires urgent attention. So more intense usage and the need for greater levels of intervention. While still concerning, the survey is suggesting low risk perception and very concerning, I should say. It's very concerning that there is a low risk perception around vaping. And that's the effect and impact of marketing. There's a view that if you take the natural smoke, as would be the case when you compare vaping with tobacco, traditional tobacco, then somehow you're engaged in a healthier practice. And we want to disabuse people's minds of that. In fact, there may be evidence in some instances to suggest that it is more dangerous because of the chemical concoctions that are placed in these devices. And that needs to get across to the population. We have to get all on board as it relates to that type of education as part of the behavioral change. So the expanded mandate of the NCDA to address mental wellness, as well as the provision of specialized services to dually diagnosed clients, those with mental health disorders and substance use disorders. There's need for increased public engagement around issues of this kind, including at the level of communities, institutions, schools, so to drive greater awareness as part of the strategy going forward. And then slide 17 speaks to the next steps. The first order of business now is to get people in the know about the scale of the drug problem that we are facing, with widespread dissemination of the findings from this study among multiple audiences, and expect us and our collaborators, some here in this room, to use the information, hopefully, and to disseminate as widely as possible. We'll also be engaging with stakeholders and partners, as I said, at the parish level, community level, to garner support and to be creative in the level of dissemination so that different audiences, different socioeconomic groups. So there's a general understanding as the first point of developing particular strategic interventions. A national drug research network is to be established, comprised of academics and technical experts who can draft an agenda for drug research that goes beyond prevalence studies to take a deeper dive into this cross-cutting issue. So the idea is to pull a team together and to interrogate the data, if you will, and from there develop particular strategies around intervention. We already have a strategy now, but it's good to update that process given the new information that we have. Initiatives geared towards the high-risk areas and groups will also be informed by these findings. So where we intervene, the population that we target, the communities that we target will be informed by what is here. Sustained public education campaign will also be rolled out in short order to increase awareness on services, as well as to help people to understand the implications of drug use, particularly our youth who are among the most vulnerable. Also, as mentioned, there is more to come with the sharing of the synthetic drug study, which looks at the treatment of new and emerging drugs, not only in relation to public security, but also to public health. And we will pursue these efforts in earnest because we now have the information that gives us currency in terms of the claims that we make. And that's the great value of this study. It allows us now to move in a direction where we can quote local data, not just international data, and use that data in a more decisive way with greater conviction that our interventions are in the right place and are of the right mix to address the challenges that we face. So I want to thank you for listening. And I know it was long, but I think it was necessary. We will eventually make the study available online on the website, the ministry's website. And of course, expect to see a dissecting of the information, dissemination, social media and otherwise, to continue to drive that kind of information. Thank you very much, and I hand back now to Madam Chair.
Thank you for that, Dr. Tufton. Quite a broad range of issues identified in the 2023 Drug Prevalence Survey, and you actually do have access to the survey, which you If you scan the QR code here, you will find some kind of representation of the national picture. So not the full findings, but you will have the map of Jamaica displaying some of the key areas of concern, the parishes that Dr. Tufton mentioned, and the substances that are most prominent in those areas. So at this time, I will invite our media colleagues on the floor to indicate if there are any questions that you have for Dr. Tufton at this time. Or you may have questions for Mrs. Atkinson or Mrs. Spencer-Smith. We ask you to indicate by raising your hand. We have a roving microphone. Please state your name, the media house that you are from, and direct your question at this time.
Yes, hi, good morning, everyone. My name's Emma Lewis. I'm a blogger and writer, and there's a couple of things I wanted to ask about regarding the synthetic drugs. And in particular, I was thinking of the magic mushrooms. I'm not sure if they come in that category, but the ministry had put out a couple of press releases about the magic mushrooms, that discouraging people from using it, and stating that there were regulations, or it wasn't regulated yet. I wondered what the actual position is with regarding that particular drug, because I do know that people are using it, and it's being marketed as quite, acceptable, even in the tourism industry. I'm thinking of Negril in particular. I just wondered what the position is on that, or whether you're going to or you're going to wait for the result of the assessment. My other question was regarding prescription drug abuse, and I wondered, I'm not sure if it was in those slides, but I wondered if you had any thoughts on that, especially regarding older people, older Jamaicans. We always think of youth and drugs, but there are older Jamaicans who are also sometimes dependent on prescription drugs. Sorry, 2 questions there.
All right, thank you, Emma, for the questions. Dr. Tufton will respond.
Okay, thank you very much. Are you hearing me? Thank you. Okay, so the first question around magic mushrooms. It is an increasing, it's not emerging anymore because it's happening in the country and in particular parts of the country. From public health perspective, while there are concerns, there are concerns and major concerns that the use of this substance as a remedy for different types of ailments is not supported at this time, and I say at this time, by clinical trials, and as a consequence there isn't support for its application. But there is a recognition that it does take place and across and throughout the country, and in some instances guided by clinicians who are involved in its application, psychiatrists and other clinicians. But the official position of the Ministry of Health and Wellness, and by extension the government, is that the clinical trials to support this have not been assessed and approved as part of our regular approach as a country to allow for these different processes to take place. Now, it may change in the future because it is now more a common practice than the exception. These are things that we have to look at, and why a study such as this is helpful to see what is emerging and what we have to do or say about it. But as of now, it's not an approved approach from the ministry. The second question was about prescription drugs and abuse. I mean, the clinicians can guide. We don't have a clinician here, but at the table. But the truth is, anything can be abused. I mean, salt, sugars, and fats in excess can be abused also. What we have to do is to inform, educate, and to try to get people to follow the clinical guidelines. In the case of a senior citizen, it clearly is your doctor. And the abuse also takes place by not completing your regime once you're given a dose to take. So it happens on both fronts. And we're all guilty of that sometimes. So we get a 5-day dose and we take 3 days, and because we feel better, we think that it's over. And it is considered not effective, and in fact leads to other problems later on. So a big part of that is going to be education and just keep reinforcing the messaging around prescription drugs. Yeah, go ahead.
Okay, thank you. If I may add about the prescription drug use among the older populations, they sought to determine lifetime prevalence of the use of prescription drugs. So we didn't actually drill down to look at current and more problematic use, but there is more disaggregation of the data that we can do to look at the older population to see. It's not reflected today, but that is data that we can analyze further. I would also want to say that following the COVID-19 pandemic, well, yes, right after the pandemic, the National Council for Senior Citizens reached out to the National Council on Drug Abuse, indicating an interest for partnership because of the clear indication of increased drug use among their members. And so this is a partnership that we want to certainly look to extending and also deepening to be able to determine what's happening particularly among that group. So we would have to do, whether it be qualitative or quantitative, further work among that group.
Do we have any other questions from our media colleagues? So we ask that the microphone be passed. Please state your name, the media house that you're from, and direct your question.
Sure. Good morning, Tiffany Price from the Jamaica Star. So you have indicated, Minister, that there has been a spike, which could be due to the changes in the decriminalization of ganja. What exactly or specifically are your concerns as it relates to it being associated with accidents? And secondly, with the vaping in schools, what exactly is the ministry doing in its trust to eliminate vaping as well as psychoactive drugs?
Okay, Mike. Right. So, first of all, let's just appreciate that we are reporting on the findings of a survey, and what it requires, therefore, is that we have to now get to the next level, which is to assess, do a deep dive on some of this information. What is very clear for us, however, in the interest of transparency and consumer knowledge, meaning the population knowledge, that we make the information available, and that's what we're doing. We're disseminating at this point. So some of the specifics around the responses are going to be based on a deeper examination of the information, and then from there on in, we'll determine what transpires. Now, the legislation around marijuana did create the opportunity, clearly, for those who consume, to consume in a context where they are not criminalized, and that's not a bad thing in terms of what was the problem before. For us in public health, clearly our intention is to discourage consumption, because any smoking we think is bad for you, But in the first instance, and in terms of what is happening here, to get people to be aware of what is happening in the environment. Now, the relationship between that or alcohol abuse, any other substance abuse, and road traffic fatalities, the study also has a perspective on that. And what we have to do is to, again, deep dive to determine how best to deal with it. So I know I'm not giving you the kind of responses that you may want. What I'm saying is, for now, it's about understanding, and then beyond that, we move to the next level in terms of the specific intervention. In terms of the schools, there's going to be a lot of collaboration that's required. Already there is in the school system, Ministry of Education, Ministry of Health. We're going to have to do more, and certainly around vaping, which is a big problem. And we have seen the anecdotal evidence of that as now confirmed by the study with kids, young people in schools, turning up at accident and emergency wards and so on. So there is a problem there. And again, it has to start with education and then collaboration around a response.
We would just like to add that, based on the information shared, when we heard that there's an increase in the level of, or the intensity of use, we want it to be clearly understood that we're not saying that there's a spike in the general prevalence of ganja use. So hopefully tomorrow we will not see headlines saying ganja use among Jamaicans has increased since 2016. It is the intensity of use among people who already use that has gone up. Is that clear? Hopefully that's clear. One other thing I'd like to highlight is that this is a general population survey, and we do secondary school surveys which give you a clearer picture as to what is happening just among that population. Not to say that this information is not reliable, but this is a different kind of survey with a broader population band that doesn't necessarily tell us exactly what's happening in the school setting. Our secondary school surveys do that best. Thank you.
Do we have any more questions at this time?
Thank you. Good morning. This is Khaleesi Wright from Nationwide News. Two questions. So the last study was done in 2016. My question is, how often is the study done? Is it done every 7 to 8 years? And also the statistics. The study has shown alarming statistics. Does this mean that it will prompt you to do the study more frequently to assess if proposed solutions are actually working to limit these things?
First of all, we want to say that typically, countries that do these national population surveys rely, particularly countries in the Caribbean, rely on funding from the Inter-American Drug Abuse Control Commission, the OAS. This is the first time that a study has been self-funded by a country in the Caribbean. So, yes, you can clap. More people can clap. Because it indicates a level of importance that we give to this issue. Prior to this, we had not been able to do studies in the US and Europe and so on. They do studies on an annual basis. We don't have that kind of money. We don't have a cycle of doing these surveys, but this we were very grateful for that it was internally funded.
And just to say, a lot more studies to come. So, no, because it's important. One of the concerns that I had, and maybe it's my academic background, having been at the university for some time, is that our data, a lot of our decisions tend to be driven by international data, by global data. And it doesn't account for the nuances of our local environment. And I've been a firm believer that we need to do more to understand our context and our circumstances, and then allow the tailoring of our responses to suit those arrangements. So this was the primary justification for this. Plus, remember, we're doing a lot of work on tobacco, control, the legislation, as I said earlier. We have a draft alcohol policy that is being developed. And then with these new and emerging drugs, it's important for us to understand them so that a conversation can begin to see what the policy framework around these things are. So it's very important. We have a wellness fund, finally, I'll say that hopefully I'll speak to soon, where about 5 or 6 other studies are going to be funded via the National Health Fund around a range of issues in public health. And this wellness fund was announced by me a few years ago, and it has worked its way through with persons or groups applying to do particular studies that are relevant to our context. And I'm hoping in a few weeks, or maybe a month or so, to announce the recipients of that funding. And it's something that we'd like to continue to do as we go along. Thank you.
Do we have any other questions from our media colleagues?
I'm sorry, I just thought of another very broad question I wanted to ask. How does this link in with your work in mental health? Do you work together with the mental health sections of the ministry to see the correlations and things with drug use?
Morning. So one of the areas of transformation for the National Council on Drug Abuse is now that we are going to be supporting mental wellness. And so, yes, we are certainly going to be working together with the Ministry of Health's Substance Abuse and Mental Health Unit, but we will now have persons on the ground building protective factors for mental wellness.
Thank you. Well, there you have it, ladies and gentlemen. The findings of the 2023 National Drug Prevalence Survey on a broad range of issues, including the narrowing of the gender gap, increases in intensity of substance use, youth risk perception, driving under the influence, and much more. We want to thank you for your patience and your time. Certainly thank you, team, Dr. Tufton, Mrs. Paulette Spencer-Smith, Executive Director of the NCDA, and Mrs. Uki Atkinson, Senior Director of the Research Branch. We thank you so much for your time. Do you have any closing remarks, Minister?
No, I think I want to thank everyone for being here, and just to say that this is the start of a process, so we expect more to be said on this, more conversation, more dissemination. We would like to partner, so to the extent that other agencies or stakeholders would like to have a conversation on some of these or all of the elements, let's do it. Whether you are pro or against, I have no issues with that. I think the debate is healthy. And so we do anticipate some responses from industry, including in the case of some of the legal substances, alcohol, maybe even tobacco. And that's fine. I think everybody has a right to comment. We want to ground our conversation in the facts. And a survey of this kind gives us a lot of information on which to discuss. So I will say, let the conversation continue, and hopefully from there, policies and programs that protects the Jamaican people from a health and wellness perspective. Thank you very much.
And with that, we thank you for joining us at this press conference. I'm Kedisha Watkins. It's been a pleasure. Let me announce that the NCDA team will have a staff function immediately preceding this, and so we thank you for your participation. We ask that only those team members remain in the room for that function. Thank you.